Hey, good morning, doctor.
Good morning.
I know that you work as a pain management specialist and you're the medical director of Gulf Coast Injury Center, right?
I work as the medical director there. I work kind of as a occupational physician or occupational medicine. My background is anesthesiology, though. So, and one component of anesthesia is pain management. So that background has lent itself very nicely to this type of work.
Well, I appreciate you being here because I have some questions about medical marijuana, recreational marijuana. This whole topic has blown up, and I think that there have been a lot of assumptions by consumers who have been, I don't know if they've been sold a bill of goods that they don't understand what they're getting, but it gives me a pause. I'm not, I grew up in an age where people used, pot around me. It was never my thing, but I have kids and I'm certainly concerned about what their perception of this will be. I'm not a person who likes to take anything, to be honest with you. Like you know, I I have to be dying to take an ibuprofen because I just don't really like to put anything
Sure.
in my body that is, a chemical of any sort. And I feel like it's going to have a good effect or a calming effect. It might have some other effects as well. I don't think anything's free.
Mm-hmm. Yeah.
But this topic of marijuana, people seem to view it, I don't know, they seem to view it very Pollyanna, very innocently. They think they're getting an herb that is never going to be harmful to them. And it seems different to me now than it used to in the sense that the pot even smells different. It smells like BO. I would go to a concert and everybody would be smoking around me and it smelled like an herb wrapped in paper. Now this smells like body odor. It's got to be different. It's got to be stronger.
It is stronger. It's much stronger than when you and I were young and back in the 80s or in the late 70s. And the percentages of THC in some of these products now get up to 28, 29%. I mean, that's very, very potent medication. I don't think that marijuana is benign in any manner, but it is exceptionally helpful in some situations. And I've witnessed that firsthand. We talk about marijuana, medical marijuana, in a couple different ways. We talk about the two opposite ends of the spectrum to start with. CBD being a potent anti-inflammatory. It's not intoxicating. It is psychoactive. So, like if you have generalized anxiety disorder and you don't want to be intoxicated and you want to use something natural, CBD will bring your anxiety down. You have to use it consistently through the day, and it takes about a week and a half to 2 weeks to set up, and it should bring your baseline anxiety level down. And it also acts as a potent anti-inflammatory, and it works at what we call the CB2 receptor to bring inflammation down. So things like migraine headaches, muscle spasms, and
Oh, wow, migraines.
multiple sclerosis or Parkinson's. It helps with anxiety. And it helps in a bunch of other ways as well. And then at the other end of the spectrum is THC. And THC is beneficial from like an anxiety standpoint. It intoxicates you and kind of just brings your anxiety down. It helps people fall asleep so at nighttime they don't perseverate on the things that make them anxious through the day. Bills, kids, school, work, all of those things. So it can help in that fashion. With respect to pain, THC doesn't do a lot to treat the underlying cause of pain, but it distorts your perception of pain so that it's not as bad. I think people are very cavalier in the idea that marijuana should be recreational and people should have access to it. And I don't agree with that. Some of the
And you're the medical director of a facility and you have prescribed marijuana.
So I do medical marijuana recommendations. It's not a prescription, it's a recommendation.
Okay.
And I do them, actually, I had patients that have been in auto injury situations. But I do the work for a company called DocMJ, and patients will come in and they'll see me, and I've had patients literally bring in bags of medicines, morphine, Valium, duloxetine. I mean, just literally, and just set them up on my desk and say, I don't take any of this anymore. That's powerful.
That's very powerful. That's a success story.
Super powerful, because
That's medical marijuana.
that's medical marijuana. And the thing is if you were to overdose on marijuana, yeah, you could wind up in the hospital. But you're never going to die from marijuana, right? It doesn't affect the respiratory centers in the brain and the reticular activating system. And so you're not going to stop breathing because of it. Whereas drugs like morphine, oxycodone, people die from that.
Right.
They die all the time. And that's why the CDC and the DEA are so, make it so difficult to prescribe that medication. Before, 20 years ago, we could just write out whatever prescription we wanted for a patient. Bike it in. You want 240 of them? Okay, there you go. Tramadol was in fish bowls in our office. You could just grab a handful of it and put it in your pocket.
Now, my mom's in her 80s, and tramadol is like her go-to thing for sleep, for this, that, and it's certainly not good for long-term use with your mentation. I mean, I can't even imagine relying on something like that to sleep, relying on something like that for pain control. It's so detrimental.
It can be,
And that's a lighter case.
But it could be dangerous too, because you never know what kind of situations your patients are going to find themselves in, right? You don't know if that patient, if you prescribe that medication, you don't know if they're going through a divorce or if they have underlying depression that they weren't upfront with you about, and then you give them a prescription and they take all those medications and they stop breathing. And I've seen that. I've got friends who've had patients die, patients that they've had many years who've been consistent with the medications month after month, and then some life event occurs and they're like, I'm done. And so they take these pills and they can find themselves in a serious medical state. And marijuana, you just don't find that. Now, I will say it's not benign. I don't think, and I'm not saying this because I'm a physician and I do medical marijuana recommendations and I get paid to do that. I'm not saying this for that reason at all. But the thing with marijuana, especially with men or individuals that are younger than 25, the brain hasn't fully developed. So medical marijuana could decrease your IQ. It can lead to substance use disorder. It can lead to impaired ability to make executive decisions. So those are all very important things that young kids don't really understand fully. And what they see is, oh, I want to get high and I want to feel good.
And parents are actually, which is insane to me, but parents are actually okay with it. I mean, I've seen kids who don't have cancer. They are not undergoing any particular extreme physical event. They have anxiety, perhaps. I'm not saying that there's some normal component of anxiety throughout adolescence. I'm not saying that there's only that. I'm sure some young people can experience more, but it seems like they're getting these medical marijuana cards willy-nilly with their parents' blessing, because their parents' thought processes, they're going to do it anyway, and at least this way they're not in a bad neighborhood where they can get arrested and be exposed to fentanyl and all this. So that's their sort of compromise. But it's not without, even the medical marijuana is not without, it's not without some risk.
That is true.
Right?
That is true. And I think the other concern outside of medical, and I want to talk about recreational a little separately. We'll get to recreational here in a moment. With respect to medical, when I because I will see patients that are 18 or 19 or 20. And what I'd like to see with them is, have you had counseling? Have you tried medication? And I always like the response when I ask a patient, have you used medication? Yeah, I just don't like how it makes me feel. It makes me feel numb to everything. Okay, so you don't like the way the medication feels, but you like the way that marijuana makes you feel. So they don't have a real good response to that. But if they've had those things, if they've tried counseling, they've tried medication, and they still have anxiety, I will give the recommendation. You have to contextualize that, I think, too, with any addiction history or alcohol abuse or what medications they're on.
They think that you can't get addicted to marijuana.
You can't get addicted to it.
Can't imagine. I'm not a doctor, but just in terms of life experience, we all know people who have spent every day high.
Yeah.
I don't know what somebody's definition of addiction is, but when I need something and I can't get through the day without it, if it's not, food or water or air, then it's an addiction.
Yeah.
To me, no matter what it is.
Yeah. I think that do some people abuse it for recreational issues? Yeah, I do. But I think that a lot of people get benefit from it.
Yeah.
They do. And even the young patients, when I talk to them about using CBD. Don't underestimate it because it doesn't intoxicate you. It helps the underlying cause. So it's in educating the patients and making them aware of the benefits. And you talk to them about the risks as well. And you go over the consent form with them and you discuss.
So you can recommend just the CBD, or you can recommend the marijuana that has CBD and the THC with it?
Sure. Typically, the recommendations are for both the CBD and THC. The recommendations, there's the CBD recommendation, and then there's the medical marijuana recommendation, and then there is another recommendation, the smokable recommendation. And when you think of the CBD and the medical marijuana, it is there are different routes that you can recommend for them to try: oral, inhalational, edible, sublingual, topical, or suppositories. And with the smokable route, it's pre-rolled joints, it's bud, it's loose flower or grass, and but even the smokable form, some grass is super high in CBD or CBN or CBG, the cannabinoids, and has a much lower concentration of THC, and with a medical aspect, not only do you have the two opposite ends of the spectrum, CBD way up at the top and THC way at the bottom, but you have products everywhere in between as well. And dead smack in the center is a product that we call a 1-to-1. It's 1 part CBD to 1 part THC. And if you were to use enough of that product, yeah, you could become very intoxicated. But that's not the goal with that product. The goal with a product is to get symptom relief with minimal cognitive impairment. But when you give CBD and THC together, they augment each other's properties in a process called the entourage effect. The THC increases the benefit of the CBD, and the CBD increases the benefit of the THC. So there's a lot to it.
So if let's say, I'm a person that has pain, I'm a person that has problems, and I decide not to go to a doctor to get a medical marijuana card, and I decide to sort of treat myself, self-medicate. What is the difference between what I would buy on the street and the medical marijuana? What benefit does it give me to get a medical marijuana card and get the marijuana from there as opposed to on the street?
So that is a great question. And that's one thing that I always talk about patients who come in to see me, who I know use marijuana. You can smell it from the moment they walk into your office.
You can smell it when you're at a stoplight next to their car.
Right. So, but they'll come in and they use it. and I'll talk with them. And the benefits of having a card are, you know what you're getting, right? So there are so many articles out there about marijuana being laced with cocaine or heroin or fentanyl.
Yeah.
You don't know what you're going to get. You don't know what strain you're getting. I'll ask people who get it from the street, are you using a sativa or are you using an indica? I don't know, whatever the guy gives me. You don't even know what strain you're getting. And you don't know what's in it. You don't know what pesticides are used.
I get so, when I think about it, I get so, I concerned for people because, like I said, it has to be more concentrated. It has to, nothing's for free. You take aspirin every day, there can be things, upset your stomach, or, all stockles, or whatever. So there have to be not just risks of, if you know what you're getting into, at least you understand there are risks and you understand what they are. But if you don't know what you're getting into, and I would imagine pesticides or other fillers or, I don't know, even beside laced with something more serious.
Well, not only that though, you don't know what garbage your dealer is bringing to your side of the street. You have no idea. You don't know what that person's involved with. And the last thing you want is police knocking at your door,
right,
asking, hey, you got this from this guy? So, and then the third benefit is you can have it in your car. You can get pulled over. You can get a driving while intoxicated if you're intoxicated,
right,
and rightfully so. So those are the benefits of having a medical card. Are, you know what you're going to get. You can roll in your car with it legally, and there are no pesticides in it.
What kind of things from when it comes to the well, first of all, let me ask you this. I should back up a minute. When it comes to recreational marijuana, as a physician, as a medical director, as somebody who's very familiar with all the effects of marijuana, who's recommended it, what is your position on recreational marijuana?
I'm not pro recreational marijuana. I'm not. And it's not because I want people to continue to have to pay to get to see a physician to get medical marijuana. It's the reason I'm against it is I don't want it to get into the hands of kids, right? And these kids look up to people that are 18, 19, 20 years old and think they're cool and they want to be like them. And so you get marijuana into the hands of kids, it can decrease their IQ, it can unmask schizophrenia, it can lead to truancy in school. So all of these things.
That there's so much, is anecdotally, but so much more schizophrenia, adult onset schizophrenia for men. Yeah, well, I don't know. I don't think you're a man until, like I told my son, you're not a man until you can pay for your own shit for 5 years. So you're not a man because you are shaving your privates and he's a great guy. He just has to listen to his mother pontificate. But I'm just saying, I don't think a 24-year-old is a man. I think it takes a lot more than that. But these young men, these boys, these guys are having more bouts with schizophrenia. It seems like it's all over the place. I don't know if it is a combination of growing up on ADHD medicine and then, medicating themselves with pot, but it seems to be so much more common. And I know two people who are young men who have killed themselves. This adult onset schizophrenia, that's plaguing us. It's tragic, and it's having some crazy repercussions, I think, in society too. I don't know whether or not recreational pot has played a role in that. I'm not a medical professional. I'm just a mom.
Yeah.
But it makes me wonder.
Well, it's if it becomes recreational, people who have schizophrenia, people who have schizoaffective disorder, people with other mental illness are going to have access to that. And that's a contraindication to getting schizophrenia and schizoaffective disorder are contraindications to getting the THC or the medical marijuana recommendation. Or the THC component of medical marijuana. You could still give them the CBD recommendation, but not the THC, because it can unmask or worsen the symptoms of schizophrenia.
If somebody is getting CBD, that substance, and they're buying it, and it's in, and they don't want to, have their perception distorted, but they do want the benefits of CBD. Is there a difference in where they buy it? So I'm always suspicious. I mean, I'm like one of those people that's buying organic, and I just don't. I feel like there's so many pesticides that are used on so many things.
Sure.
The last thing I would want is to take something that I thought was natural and have all kinds of unnatural things on it.
So it's great that you brought that up, because we had patients that come in to our injury clinic and say, I'm using CBD. I take CBD gummies. It helps me with my pain. And I ask them where they're getting it from, and typically they can't remember. But I had read an article a few years back, I think it was 2020 or 2021, and they looked at CBD from salons, spas, chiropractor offices, health.
The dog company sent it to me from my dog.
Yeah, so
crazy.
Or even there.
Here's a free sample.
So, yeah, but this article, when I read it, it was like 72. It was about 72%, if I remember correctly, of the products they tested didn't contain the CBD content that was stated on the product container. But more concerning, and nobody ever thinks about this, greater than 80% had pesticides in them.
Oh,
So pesticides are not good at all.
cancer causing.
Yeah, cancer causing. So there's no FDA oversight over any of this. But at least in the state of Florida, at the dispensary level, there's state oversight. And so the pesticides that they use are organic. But people never think of that. I would never have thought of that until I read
wouldn't
this
have either,
article.
because people are thinking, they're almost thinking that they're doing like a natural homeopathic treat themselves. They're not using THC, and I'm sure that is true for the THC too. I mean, it just, even the smell, it seems to me that, and I was talking to somebody, a young person, about this the other day, and I said, it's like so concentrated. It's almost like if you were eating an apple versus like, getting the concentrated juice out of it. It's got to have whatever properties it has to be elevated. And I don't know what in the world they're putting in there. And it's funny because this young person said to me, and this kind of goes back to the idea of whether or not you can be addicted. He said, I know, he was a really smart young man. He said, I know that we are part of a generation of guinea pigs, because we don't know how this marijuana is going to affect us. I don't think there's been very many studies on what I'm going to call old pot or regular pot, which is like, rolling some branches up in joint paper. But this kind of smokable, all this, other type of pot, vaping.
Smoking, right.
I mean, this type of thing is, to me, quite frightening, because the concentration is increased. It's, I feel like it's almost like the cigarette lie of this generation. Like, cigarettes weren't going to be addictive, and they weren't going to be harmful, and they were just something to keep you, looking cool and being part of relaxing yourself. And now we know that not only is the nicotine terrible for you, but there's arsenic and all those other kinds of things that is addictive. It's, when they're hitting their vape, they can't stop.
Yeah.
And so you can't tell me that something you can't stop is not addictive. And then what else is in there? I mean, do we know?
Well, that's the thing. The vape pens have THC, the cannabinoids, the terpenes, but then they also have a cutting agent. And I can't remember what that is, but we don't know the long-term effects of vaping. We don't know the long-term effects of smoking marijuana. It's a Schedule I drug from a DEA standpoint. So being able to study it with respect to how it affects disease process, there are very few studies out there. So
Now, is the popcorn lung thing, is that vaping or is that the...
that's popcorn lung is from working actually in a popcorn factory.
No, well, I had a friend of mine is an infectious disease doctor, and she told me, she said, sometimes we can't figure out what's going on with their lungs because it looks so similar to that. But I don't know if it's the vaping pot or the vaping some of the other stuff.
So one of the things that can occur is vape-related lung injury, and that is usually that it occurs when people buy vape pens that are made underground, people's garages, and the cutting agents that they use are never meant to be ingested, and that was a big issue. I want to say back in like 2021, 2020, 2021, I think it really reared its head, and it scared all of us in the industry because we're thinking, holy smokes, I'm giving a recommendation for these vape pens and people are in the hospital. And it came back to people just ordering it online and getting vape pens from different states. They don't know where they're made. They don't know.
I never would have thought about that. I would have thought about the substance, but I never would have thought about what I'm smoking it in. That's crazy to me.
Yeah.
It's frightening.
It's frightening, yeah. And so that's why I think medical is a good thing, because you have physician oversight, you have state oversight at the dispensary level. Even when the cannabis becomes recreational, people may still, depending on how much you use, people may still stay with their medical cards. Just to say, whether it's an employment issue, I've got doctor oversight with this, I'm using it for a medical condition. And the other benefit would be you don't get taxed on it when it's medical. So when it becomes recreational, the taxes are going to be exorbitant. And if you're paying more in taxes than you're paying in your physician fee,
that's a good
month.
That's a good point. But so what if somebody says, okay, doc, well, some of the problems with recreational marijuana, these kids are going to smoke it, or not just kids. Oh my gosh, there's plenty of people my age who are smoking.
Yeah, sure.
Well, what if someone were to say to you, but if we legalize the recreational marijuana, then we can, maybe eliminate some of these unknown effects because we can regulate it. Do you think that if it was legalized, that it's going to be regulated to a point that we are going to be sure that it's safe from pesticides and cutting agents and all that?
Yeah, I think that
if it was recreational.
If it was recreational, it's still going to come from a dispensary. That dispensary is still going to have state oversight. There's not going to be federal oversight until it becomes nationally legal, if that occurs. But there's still state oversight. So I think that the safety profile of what it is that you're going to get to ingest, I think it'll still be very
It'll improve.
safe. Yeah, I do.
So even though, because of the effects on the brain, and because, if an 18-year-old is doing it, then, you feel like it's going to leach more easily into the younger population. Yeah. That's a con, but a pro for it would be that it is more regulated. Or do you think it would be? It's not going to be as regulated as medical marijuana, right?
You're still going to get the same product if it's recreational. You're still going to get the same product from the dispensary, but But will they have to go to a dispensary? Because I almost wonder. Let me tell you what my thought is. So if this is a product that is making the government so much money, okay, and the cry from the government, the cry, not from the government, but the cry about the government is too much regulation interferes with us making money. Okay, now that is true in whatever industry. People run industries and they rail against governmental regulation. So if
if pot is allowed to be legal and it's recreational, I can't imagine that all these people who have so much money invested in this are not going to rail against government regulation. I mean, we can't even regulate our food being free from pesticides. How are we going to effectively regulate, this substance to the point where it is a purity of, say, a dispensary for medical marijuana? I just can't see it on a large scale. I don't know if it's me.
I think that it will still have the same
Quality?
yeah, the quantity and quality. I have heard in other states that the quality of recreational is less than medical.
I
don't
would
know
bet.
if there's truth to that or not. But I think the more concerning part of recreational is it getting into the hands of children, 12-year-olds, 13-year-olds, 14-year-olds. We've all had them as friends when we were young, or like
The burnouts.
the burnouts, right? But that's not a good thing. School truancy is a horrible thing. Substance use disorder. You don't know what someone's predisposition is to substance use disorders. People don't even know their own predisposition to it. So
I guess that, people could say, well, the same can be true for alcohol, right?
Absolutely. But that happens with kids, right? Kids drink. Kids get in auto accidents. Kids die from alcohol, and many people start their alcoholic addiction at very young ages. So this some of the same things can be said for marijuana if it's recreational. It's not benign. There are consequences for trying to drum up tax money. I think you have a lot of, there are certainly corporations behind wanting to make it recreational, right? Because there's money to be made for the corporation, for the shareholders. You have people who are medical users who don't want to pay the fee to see the physician. They don't want to pay the $77.75 once a year to the state to have their medical card. They just want to smoke pot.
Yeah.
Right?
Yeah.
So,
So it's logically a parallel to alcohol to you, but we just don't need one more thing in society to fall in the hands of young people, or does it have for you specific properties that like how would, if somebody said to you, well, how are you okay with alcohol being, legal, but you're not okay with recreational pot? What would your response be to that?
I think that marijuana is more benign than alcohol. I don't think that, how I want to say this. I don't think that, I think it's better than alcohol, but I still don't think that everybody should have access to it. So
it almost sounds to me like what, and correct me if I'm wrong, alcohol is so entrenched in our society that it is and it will be. They tried to take it away.
Yeah.
Prohibition didn't work.
right. And I think the other thing too is, like I said earlier, marijuana is never going to kill you. And I think it's been demonized for some good reasons, but also for bad reasons. I think it helps a lot of people, and I've seen it firsthand. I mean, game-changing things. I had a patient who had migraine headaches. He had about a $250,000 workup. He came in and saw me, and he said, "This is my last hope for relief."
Oh wow, migraine headache said
His wife came
ruin
in.
your life if they're
Yeah.
debilitating.
Oh, they're debilitating. So I gave him the recommendation. He came back to me in 7 months. His wife signed up for an initial consult for it as well. It changed his life, took his migraines away. He used a combination of all different types of things. He used topical on his head. He used oral. He used inhalational.
I live with a
He
migraine
said-
sufferer. I actually, yeah.
He said, "This has changed my life. Changed my life." He said, "I just wish I would have found it sooner because I've been battling with this for years." And his wife was so impressed by the relief that she got.
Did you have to take it every day, or he just
Yeah.
took it? Okay.
Yeah.
Okay.
Take it as needed. Some things he would take as kind of like a scheduled thing throughout the day. But when the headaches would come on, he'd use a vape or he'd smoke something because it has such a rapid onset. 10 to 15 minutes is a peak effect, and you get relief. So it was a game changer for him. His wife was so impressed, and I think she had some back pain issues. She wanted to get a medical card because she saw the result in her husband. And so those are the patients that I love seeing. Those are the patients that make me so proud to do that kind of work. And it impacts them and changes their lives. And it's amazing. And that's, as a physician, I used to practice anesthesia, and before I became disabled from doing it. One of the things that I always loved about that is you can just push a drug. If it's fentanyl, remifentanil, sufentanil, people who have 10 out of 10 pain and are crying, you give them something, or you do a nerve block so they don't feel their broken arm, like that. Pain's gone, right? And so the same thing kind of applies with marijuana. I mean, it has a rapid effect, and it changes people's lives. So that's the thing that I look forward to change people's lives in a profound way that allows them to have better functional capacity, allows them to be more comfortable, allows their anxiety to decrease, and irritability. Because when people don't feel good, they can be anxious, they can be irritable, they can lash out, and kind of smooths all of that stuff out.
Sounds like a product, or well, I guess everything to some extent is a drug, that when it's used appropriately in the right circumstance, it has some risk, but has so many benefits.
It does.
And so I we probably have more to talk about it another day about this whole, about the quality of CBD and the quality of what people are getting. But I thank you so much for being here today, because it's really been educational. And I think that these are important topics that people are not really considering, because they don't even know. They don't even know some of the information that it's important for them to know. Yeah. I learned certainly something today when you talk about the vape pens, and I'm not even a vapor. So, thank you so much for coming over.
Thank you. I'm very thankful that you had me. I'm glad I was able to talk about it.